Please help me change the paradigm of healthcare.
The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I'm the founder of Holistic Caring. We're based here in California, and we do educational programs and case management for patients on how to use cannabis therapeutically as a medicine.
We're also here to decrease stigma around what it means to feel good and be high, hence the H for hope, I for inspiration, G for growth, and H for healing.
As the founder of Holistic Caring, I basically oversee the whole ship, and what we're doing is progressive education.
Cannabis actually supports all 11 organ systems, our immune system, and all the neurotransmitter signaling systems that give messages to tell our body to either do something or not do something. Because the plant was prohibited, it prevented health professionals, doctors and nurses from learning about cannabis as medicine.
I want to change the paradigm of healthcare, and us paving the way into a new vanguard of medicine.
It's about education, it's about empowerment, it's about teaching people how to feel good, bridging the gap from what they're not getting from traditional medicine, utilizing different plant medicines, adaptogens, tips, tricks, hugs, and nugs of information to support and nourish the most important system in our body.
It's a lot of soul work, a lot of love, a lot of discipline, and meditation. I'm using my life work as a testimony to others to learn how they can be their own hero and then go help heal the world.
And we are, as nurses, the game changers. All right. Welcome, everyone, to the Green Nurse Podcast, monthly clinical conversations where we bring hope and inspiration for growth and healing. We're here to change the dialogue and stigma around what it means to feel good and be high. And I'm sure you've heard it before on my podcast. If you haven't, you got to go subscribe. H is for hope, I is for inspiration, G is for growth, and H is for healing. It's okay to feel good. Everyone deserves to feel good, and so do you. So the Green Nurse Podcast, Clinical Conversations webcast, came about when Nurse Elizabeth and I merged our companies, Holistic Caring and the Green Nurse, alongside of Bloom Hemp, creating Holistic Caring Network. So Clinical Conversations explores all aspects of how to optimize cannabis as medicine. People are making great medicines. People are selling these amazing plant formulations, yet no one is truly interpreting how to use cannabis as medicine. And that's what we do. So I'm going to have you pull up the blog. So happy August, happy Keep Your Skin Healthy Month. So August is officially recognized as Summer Safety Month in the United States. And we covered that in our August newsletter, placing emphasis on promoting awareness about the significance of safeguarding oneself from the sun's harmful rays, while still enjoying the seasonal outdoor activities that abound. Summer Sun Safety Month serves as a vital reminder to prioritize safety and health during our seasonal enjoyment, ensuring a balance of care alongside the festivities. Our skin is our largest organ, capable of drawing in everything that we put on it. And we have cannabinoid receptors throughout our integumentary system. So caring for our skin is a top priority. And today's presentation for Clinical Conversation is on just that. Love the skin you're in, our skin, endocannabinoid system, the integumentary system. So this is our first official webinar on the Zoho platform. And during the presentation, we will have 4 polls. You can submit questions in the Q&A and we'll answer them at the end of the presentation. Those of you who would like to come on and share a case study, share your own personal study, or ask a question, will have the opportunity for you to come off of mute, come off and show yourselves on camera with us live. So what we're going to do now is we're going to actually get started with the slides and start our presentation.
Okay.
All right, so clinical conversations, integumentary system, endocannabinoid system care with topicals to optimize your health, CBD topicals, love the skin you're in. And this podcast is being sponsored by Bloom Hemp CBD, hence the lineup of the Bloom CBD topicals on the screen.
Perfect. Well, thank you, Nurse Sherry. And it is lovely to be here with all of you. Happy summer, happy sun month. And we are going to be talking about our skin, because our skin bathes in the sun, which is what we do when we sunbathe. But it can have issues, but it's not just about the sun. It's all kinds of things that can go awry. So as we're talking about the integumentary system, that is our skin. It's also known as the exocrine system. It's composed of our skin, our hair, and our nails. The skin is the body's largest organ, right? We thought the liver and the brain were big, but it's really our skin. The average adult has approximately 21 square feet of skin, about the area of a twin blanket, which weighs 6 to 9 pounds and makes up 16% of your total body weight. The skin also contains more than 11 miles of blood vessels, which is more than twice the height of Mount Everest.
There you go.
Wow. That's a wow.
That is a wow.
30,000 feet.
There we go. Okay, we have a little bit of a delay. Here we go. The integumentary system anatomy. So skin anatomy in particular. So guys, I want you guys to just imagine this. 1 inch of skin, you can figure 1 inch, has 19 million skin cells, 650 sweat glands, 20 blood vessels, and 1,000 nerve endings. That's pretty powerful. So according to the American Academy of Dermatology, your skin has at least 5 different types of receptors that detect and respond to hot and cold, touch, pressure, and pain. And some of those receptors are cannabinoid receptors. So your skin helps to regulate fluid balance in your body by providing an airtight, watertight, flexible barrier between the outside world and our inside world. And human bodies are made up of 55 to 60% water, sometimes more. It depends upon your age, your gender, and lifestyle and weight. But without our skin, we would literally evaporate.
Where would we go? So the essential functions of the skin is not just a wrap, but it does a lot of different things. It protects the body from invasion by microorganisms, chemicals, and other environmental factors, otherwise known as the outside and all of the things that get on us. It prevents dehydration, acts as a sensory organ, the feeling, all of that touch and sensations and hots and colds. It modulates our body temperature and our electrolyte balance. It synthesizes vitamin D health benefits. And then the hypodermis right under the skin has a very important role. It stores our fat. It forms a cushion over the underlying structures, and it provides insulation from cold temperatures.
Okay, this is a fun slide. I don't know how many saw the MTV Awards in 2010 with Lady Gaga and her meat suit, right? I did, and I tell you what, I was blown away. But this is just a demonstration, that we do have this meat suit, as I call it, and how our skin protects us is very, very important. It protects us from the elements, wind, water, and ultraviolet sunlight. It's a protective barrier against water loss and dehydration due to the presence of layers of keratin and glycolipids. And it's the first line of defense against abrasive activity due to contact with grit, microbes, or harmful chemicals. Sweat excreted from the sweat glands deters microbes from over-colonizing on the skin surface. And we're going to get more into that as we talk about endocannabinoids.
Yeah, imagine if it didn't do that. It was deterring those microbes, and we were crawling with these things.
Exactly.
Thank goodness for a daily shower.
Okay, we have our first poll, everybody. And I'm going to launch the poll. And the first poll is, do you worry about the impacts of your previous sunburns? So yes, no, I've never had one.
So yeah, go ahead and vote. We've got a few minutes to see if we can get all of these votes in.
Here we go. Okay, we got 75% of the voters.
One more needs to vote.
But if you don't want to, that's fine. You don't have to. Okay, and Ray, we can go on to the next slide. We can leave it up for a couple more seconds.
Yeah, we'll leave the poll open for a minute in case there's any stragglers. Okay, so where in the skin do you find the endocannabinoid system? Well, we have CB1 and CB2 receptors. These are cannabinoid receptor 1 and cannabinoid receptor 2. They do a little bit of a different thing and are generally found in different areas of the body. However, in the skin, we have both. They are in the cutaneous nerve fibers. They are in our mast cells, in our macrophages or the immune cells, the epidermal keratinocytes, the hair follicles, and the sebaceous glands. Then we also have TRPV1, which is our vanilloid sensing types of receptor cells, and they are also in the I practice that word, keratinocytes, mast cells, Langerhans cells, sensory neurons, sebaceous glands, and sweat glands. And the skin synthesizes a wide array of hormones such as vitamin D, steroids, and peptide hormones. The ECS keeps the complex neuro-immuno-endocrine network functioning optimally or in balance. And everything is about balance or homeostasis.
Okay, and then here we go. We have my favorite, the endocannabinoid system. You're an umbrella. So for people that are new, sometimes it's really hard for them to understand what the endocannabinoid system is. So I love the umbrella because it's a really great overview. So just imagine we're made up of 30 trillion cells broken down into 11 organ systems, our immune system, regulated by the master regulatory system called the endocannabinoid system. So the endocannabinoid system is the largest neurotransmitter signaling system, regulating all 11 organ systems, the nervous system, and our immune systems via CB1 and CB2 receptors. It also regulates other neurotransmitter signaling systems. So it's a balancing system that acts like a switchboard or a feedback loop, correcting cell signaling to restore balance. So it senses what's going on. Generally, we're running too hot and it's trying to turn things down. And so the endocannabinoid system signals both the fight or flight response and the relaxation response. Stress in the body triggers the release of the anandamide in the 2-AG, our own body's endocannabinoids, to activate CB1 and CB2. And when we don't make enough of our own, we may have an endocannabinoid deficiency, which we're going to talk about in the upcoming slide. But phytocannabinoids, CBD, THC, also activate CB1 and CB2 receptors. CBD indirectly modulates the receptors. And the goal is homeostasis amongst all of the body systems. So the endocannabinoid system, imagine, is going on and off all day long, regulating both the fight or flight response and the relaxation response. And guess where we function best? We function best when we're in the relaxation response. Anything to add?
Well, and I love how you chose to have the umbrella. And
it's rainbow.
Yeah, and the endocannabinoid system is showering on all of our other systems, right?
Cool, because we have cannabinoid receptors on every single cell surface of every single organ system. And we have cannabinoid receptors at the neurotransmitter signaling junction site. So when I'm teaching the umbrella, I imagine that the different color fabric pieces of the umbrella are the different neurotransmitter signaling systems. For example, dopamine signaling, serotonin signaling, opioid signaling, TRPV1 signaling, GABA, glutamate, right? So we have all of these signaling systems that are actually regulated by the master system, endocannabinoid system. Pretty good.
Yeah, and so the endocannabinoid system is within the integumentary system. And as you can see, we've got our CB1 and CB2 receptors, our TRP receptors, and then you see anandamide and 2-AG. Those are the endocannabinoids. And cannabinoid therapeutics have, over the past couple of decades, many studies that have confirmed that cutaneous cannabinoid signaling is involved with the maintenance of normal skin homeostasis, barrier formation and regeneration to make sure that we keep out what's supposed to be out, protecting our internal organs and our skin regeneration, always making new cells. And a balanced ECS shows that we have good skin, no problems or conditions. So in other words, same thing with all of those other systems. If our endocannabinoid system is healthy, odds are that we're healthy and we show up as healthy. When the endocannabinoid system is not healthy, it deregulates and there's diseases. And that's why there's drug targets, just like anything in pharmacology. We want to be in homeostasis, and obviously it all works together to keep our body healthy and whole, and it is a miracle.
It is a miracle. So studies, integumentary system research dashboard. We love using Cannabis. It's one of our favorite research places to get information. And they update. Every time I go in there, I was just updating another slide deck, and they keep adding generally 2 to 3 new clinical studies every single day. Really, really powerful. So Cannabis studies the integumentary system, as we said. It's the hair, the skin, and the nails. And they do have over 291 total studies, 2 clinical medical meta-analysis, 12 double-blind clinical trials, 16 clinical trials, more meta-analysis and review, 69 animal studies, and 99 laboratory studies. The country that is studying the integumentary system the most is the United States. And as you can see, when we're looking at this, what they're studying most is CBD. So when we're looking at chemotype 1, 2, and 3. So chemotype 1 is in the blue, which is more THC than CBD. Chemotype 2 is equal amounts of THC and CBD. And chemotype 3, I always like to say chemotype 3 is for me because it's legal in all 50 states, more CBD than THC. And so the studies are reflective of more CBD than any of the other cannabinoids.
Mm-hmm. Yeah, and to give a synopsis of some of the cannabis research and the ECS, a 2009 collaborative study from Germany, the US, England, and Hungary delved into the abundant presence of endocannabinoid system modulated receptor sites, CB1, CB2, in the skin. And these findings suggest promising strategies for treating a range of skin functionality. So regulating cell growth, differentiation of that cell growth, cell survival, and our immune responses. The researchers propose that supplementation of the endocannabinoid system could offer benefits for numerous skin ailments such as acne, dermatitis, dry skin, hair loss or alopecia, excessive hair growth or hirsutism, itching, seborrhea, skin tumors, pain and inflammation, and psoriasis. And when people suffer from skin conditions, they might look like this. It is a problem. I've had some itching before in the past, as is my family. Eczema runs in it, and it can be genetic, brought out by environmental triggers.
Okay, so research on skin conditions with CBD. Again, this is Cannabis research. We love Cannabis. Dr. Uwe Blechen has given his blessings for us to share. And so these are the top research on skin conditions with cannabis and CBD. So acne, head and neck squamous cell carcinoma, melanoma, skin cancer, non-melanomas, night sweats and excessive sweating, allergic contact dermatitis, eczema, fungal infections, abnormal hair growth, hair loss, herpes, wound healing, psoriasis, systemic sclerosis and scleroderma, pruritus or itching, skin fibrosis and scar conditions, burn injury, edema, sunburn, and longevity, or what I like to say, anti-aging. And so there is research on all of these different conditions, and these are live links. So at the end of the show, when you're done, you're going to get this PDF in an email, and all of these links go to live research. So you'll be able to look at that.
You click on each one of them and all of them if you want.
Okay, we have another poll. Okay, poll number 2. Do you suffer from eczema, psoriasis, acne, or an autoimmune disease? You don't have to answer if you don't want to, but this is just a poll for those that might be interested in answering the question. It'll help us with our research if you'd like, and then we'll leave this up for a couple more seconds for those that would like to. Okay, you can go to the next slide. Okay, so what I will do is I will publish those results and go on to the next slide.
All right. So for those of you who are new, what is the endocannabinoid system? We've talked a little bit about it. Now it's time to just explain it a little bit. And so the endocannabinoid system is what blankets over all of our other systems, and through what we call retrograde signaling or feedback, it enables it to correct cell signaling and messaging. The endocannabinoid system consists of three parts. One is the endocannabinoids, anandamide and 2-AG, which we make on demand. Those are the endocannabinoids. The phytocannabinoids, CBD and THC, mimic the endocannabinoids. So if we have THC and CBD in the body, they can actually fill in the gaps if we're not making enough of our own anandamide. Then there's the receptors, so CB1 and CB2, and you can see these receptors on the cell membranes. And then those are what is plugged in by the endocannabinoids or the phytocannabinoids. And then there's enzymes that synthesize and break down the cannabinoids after use. And so FA and MOGL, they create our endocannabinoids and then they break them down. And so what we want to do is have all of these three components work well and be in parameters that keep us healthy. And the cannabinoids are the keys that fit into the locks to keep us all running well. And they control all of the cell signaling with all of our other neurotransmitters, as Sherry was alluding to. And they do so through retrograde signaling. And just real quick, most of the time we have things going from presynaptic to postsynaptic. So if you remember your biology lectures, that's how cell signaling goes. But the endocannabinoids float backwards, and they plug in with retrograde signaling, and they are able to be listening like a good switchboard operator who's always making sure that things are humming just right, and then they make those corrective signalings. And that's literally, it's very detailed and complicated, but that should be a shorthand version for you.
Right, endocannabinoid system. So clinical endocannabinoid deficiency. So when the three components of our endocannabinoid system don't work effectively, messages don't get relayed and the body malfunctions, hindering our ability to adapt to outside stressors, and we can get sick. So oftentimes when I'm lecturing, I'll have people say, "Oh, wow, Sherry, that's so cool. I love it that I make components in my body like the plant. I love it that the plant makes THC and I make anandamide and the molecular structure is very similar. Well, gosh, if I make components in my body like the plant, then why do I need the plant?" And my answer is, if your umbrella isn't going up and down nicely, then you probably need the plant. And there's reasons why people have an endocannabinoid deficiency. As we age, generally our endocannabinoid systems are fully developed by the age of 25, yep. Right? All of when we're in our prime, the age of 25 in particular. And as we get older, our endocannabinoid system can change, and it generally has to do with lifestyle. Genetics also plays a huge part in it, but the main things is diet. Think of fast food, fried food, fake food, artificial flavors, artificial coloring, trans fat, hydrogenated oil, high fructose corn syrup, and sugar. And all can cause an endocannabinoid deficiency. Lack of exercise. I like people to think of motion is the lotion. That runner's high that people talk about is actually anandamide molecule, that bliss-like molecule that mimics the THC molecule from the plant. So exercising helps to support and nourish the endocannabinoid system, where a lack of exercise doesn't. Obesity, people that are obese have an overabundance of the anandamide molecule in their body, and the receptors aren't working appropriately. Glucose metabolism is affected in a way that is negative, and this can also cause a downregulation and an impact on our endocannabinoid system. Poor sleep and insomnia, not resting, smoking cigarettes, chronic alcohol use. I never want to alcohol shame anyone, but there is no therapeutic use of alcohol, never, not one time. Alcohol depletes our body of B vitamins. B vitamins is what is needed for us to bathe our central nervous system. Polypharmacy is another thing that could cause an endocannabinoid deficiency. A lot of people don't know this, but if you're on 5 or more medications, there's a 50% chance that there's a drug interaction. If you're on 10 or more medications, 100% chance that those drugs are interacting, and probably not in your best and highest interest. The big thing with pharmaceuticals that a lot of people don't know about, that I learned about when I got sick, when I was on a whole host of them, was that they cause a drug nutrient depletion. And there is a beautiful book out there called Drug Muggers, meaning that specific pharmaceuticals can prevent certain nutrients from being absorbed properly. So you must supplement or make sure you eat enough of those foods. And then again, the other things that can cause an endocannabinoid deficiency is diminished social interactions, lack of touch, lack of laughter. So we really, and we're going to talk about how we can nourish the endocannabinoid system in an upcoming slide.
So if you can, hug your sweetie tonight and watch a funny movie.
There you go.
So endocannabinoid system deficiency correlated with several skin disorders. So when the ECS is not balanced, what can we get? Atopic dermatitis, psoriasis, scleroderma, acne, excessive hair growth, pigmentation disorders and coloring, patches, keratin diseases, various tumors and skin cancers, and itching and pruritus, which drives people absolutely crazy.
There you go. Okay, so endocannabinoids and phytocannabinoids. So this is a little bit repetitive, but we want people to truly understand this. So the endocannabinoids are made in the body. Anandamide, or AEA, 2-AG, binds with CB1 and CB2 receptors. Endocannabinoids are lipophilic, fat-soluble, and made upon demand in response to a stressor. So the plant phytocannabinoids mimic our own endocannabinoids. So the endocannabinoid system is going on and off all day long, releasing endocannabinoids upon demand to correct cell signaling, right? And so we can optimize this many different ways. And if we don't make enough of our own, like we saw in the last slide, we can see messages not getting relayed, and the body's always trying to autocorrect itself and to get back into balance.
And these are some of the most common ones. So THC, CBD, CBN, CBC, and CBG on the phytocannabinoids.
Yeah.
And then if you see down here, olivotolic acid, diverneric acid, our endocannabinoids are made from essential fatty acids. So we need to be eating a good, healthy diet with fats. Don't just eat everything fat-free. You need good, healthy fats, eggs and avocados and yogurts and
Coconuts.
that sort of thing. Coconuts, yeah.
Nut butters.
So yeah, nut butters. And they really help. And this is, again, just a recap of some of the graphics that you might see. Anandamide fits into the CB1 receptor and the CB2 receptor, as does THC, which just lock and key right in there. And then you can see the molecular structure of anandamide and THC being very, very similar, where it just plugs right in there. When we don't make enough, we can supplement.
Okay, so 3 different types of cannabinoids for homeostasis and mind, body, spirit. So endocannabinoids we make internally. The anandamide and 2-AG are the examples. The phytocannabinoids are made by the cannabis and the hemp plant. And the most common ones are THC, CBD, CBG, CBN, THCV, CBDA, CBGA, and there's a lot of others, but these are the most common. And then we have the synthetic cannabinoids that the pharmaceutical company makes. So Marinol is synthetic THC. Epidiolex is not necessarily synthetic, it's purified CBD, 99% pure CBD. And then Sativix isn't here in the United States, but it's in other countries being used for MS spasticity. And Sativix is a 1-to-1, so it's equal parts THC to CBD. So as you can see to the graph to the right, THC is a plant phytocannabinoid that mimics the anandamide molecule to bring balance to the cell. So the plant makes THC, we make anandamide, the molecular structure is the same, very similar. This allows for THC to mimic anandamide by connecting to the nerve cell receptor in its place. So endocannabinoids are responsible for homeostasis in the body, promoting what we call the Goldilocks zone. So by activating receptors on cell membranes, cannabinoids restore balance at the cellular level, allowing for downstream healing in multiple different sites, all at the exact same time. The interesting thing that a lot of people don't know is that phytocannabinoids are 10 times stronger than our own endocannabinoids and last for several hours, as opposed to the microseconds to the life of anandamide and 2-AG. So just imagine the THC molecule, the anandamide molecule. THC is 10 times stronger than the anandamide molecule. The anandamide molecule, when it's synthesized, it's made upon demand to nudge that receptor and is broken down immediately. And when we take THC, it plugs into the receptor a little bit stronger, a little bit tighter, and a lot longer. So that's why we don't need a lot of THC.
Just getting the image of a bus or a commuter train where people are jumping on and off all the time, but you've got one rider or a couple of riders that are there like for the whole duration of that track. That's kind of like THC is always in there. It locks on for hours and hours versus the commuters that just jump on and jump off in a second.
Okay, and we have our third poll here. This poll is, do you struggle with painful inflammation, sports injury, or muscle spasms? There we go.
I vote yes.
I vote yes, too.
That's how I found CBD. I always had sports injuries.
I didn't have a sports injury, but I had a horrible autoimmune condition. Horrible. So, yes. You people are voting. Yep.
Okay, good.
Yep. Oh, good we go. Okay. Most voted.
Sometimes
Here we go. We got 33, 33, 33. So that's a
nice.
published result. So we can go on to the next slide.
Okay. So what do we mean by a toolkit, right? A toolkit is needed to approach this. And this is how we counsel and coach patients. It's not necessarily just one item that we're going to be talking about, although a topical is generally how most people get introduced to this. That's what happened to me. But a toolkit helps us manage all of our conditions internally and externally, especially with those sports injuries. I've had 3 shoulder surgeries, and I have a topical every night, which helps me go to sleep and relax my neck and shoulders. And then I have tinctures on the inside as well as capsules, which help the long term, right? So this is the superficial areas and the localized relief. Tinctures are short-acting internal relief. Put these drops under your tongue, hold it for 60 seconds, and then swallow. Capsules and edibles and gummies. This gives us the long-acting, so we've got 6 to 8 to 10 hours, depending on dosing, of sustained release, symptom relief. We've got sublingual strips, which are very short-acting, very much like tinctures, about 2 to 3 hours, and this is about 3 to 4 hours. Transdermal patches you can put on, just like the nicotine patches, and we can have a full 24 hours of relief. Suppositories for rectal and vaginal for localized things as well. And then inhalation for the immediacy when you really need to get out of pain in a pinch. So this endocannabinoid system supplementation from the phytonutrients aids in the production of anandamide and 2-AG. So the more we supplement and balance our system, the more that it comes back online, if you will. And then the endocannabinoids are produced in the same concentration in our skin as they are in our brains, which tells you how much the skin is that big sensing, feeling, protective mechanism that we have on the outside. We've got the CB1 and 2 receptors in the skin, hair follicles, sweat glands, and nerve fibers of the skin. And then CB1 and CB2 are the receptors that mediate the inflammation and pain sensation in the skin.
There we go. So skin condition examples. So this is the most common skin conditions. This is an image that I found, and these are some of the cancerous skin lesions that are below growths and conditions that you can see. But these are just skin condition examples and cannabinoid benefits. So acne in particular, CBD increases levels of our own anandamide by inhibiting FAAH, which reduces activity in our oil glands. And CBD is also known to be antibacterial. Allergic inflammation of the skin. THC and CBD reduce skin inflammation, and beta-caryophyllene, which is a terpene, but also a cannabinoid that interacts with the endocannabinoid system, can also help with itching and histamine response. Very, very powerful. We've used beta-caryophyllene a lot. Thank you very much, Dr. Blair. And then psoriasis in particular. So psoriasis and psoriatic arthritis are very, very painful conditions. CBD can stop the overproduction of keratinocyte cells, the skin cells involved in producing the itchy, flaky layers of the skin associated with the condition. So cannabinoids can also, reflect proliferation, right? So anti-proliferative effect in reproducing these extra skin cells and skin tumors in particular. So FICO, full extract cannabis oil, also known in some dispensaries as Rick Simpson oil, also known in the legacy market as Rick Simpson oil. Rick Simpson was a man who actually treated his head injury and basal cell carcinoma on his arm and managed his pain using the RSO oil that he actually made. And so RSO is basically Rick Simpson oil, But when you're seeing it in a dispensary, you might see it now called FECO, or full extract cannabis oil. So it's a whole plant formulation. It's usually extracted in ethanol, and to maintain the consistency of the cannabinoids, terpenes, essential fatty acids, bioflavonoids, cannaflavins, and all of the yummy goodness that's in these oils.
Yeah. And some of the serious ones like psoriasis and skin cancers, you definitely need to be thinking about that inside, outside.
Yes.
Right. So on psoriasis, you want to put on a soothing balm that's going to help with the psoriasis. But then you also need to address the inside with the cannabinoids, CBD, CBG, CBN, THC, to really stop some of the imbalances that are going on internally, which is always in the immune system.
Yeah, and when Rick Simpson treated himself, he did the inside out.
Yes.
He didn't do just the outside.
Not just the topicals.
Yeah.
So the beauty of cannabinoid topicals, and this is really where it's going also. There are, if you go to Sephora, a lot of these other boutiques, they're all selling CBD in some of their top selling skincare. And so cannabis topicals are a great introduction to cannabinoid therapeutics because they are non-impairing and easy to incorporate into a healing routine for any consumer. When I first came to CBD, I had a medical massage at my chiropractor's office. She was putting cannabis on my shoulder, working on it. And I said, "What is this? It smells funny." And she goes, "It's cannabis." And I said, "Well, why are you putting that on me?" And she said, "It's anti-inflammatory. It's going to reduce your pain and get you back to that pre-surgical arm faster." So I said, "Sign me up and tell me more." And that was how most people get into this. I can't tell you how many people started on their knees and now they can walk and they can hike again. And it is a good first product. So the topical products are applied to the skin for localized symptom relief. It's not systemic, doesn't cross into the bloodstream, so it doesn't get you high if there was to be THC in it. Topicals can include creams, lotions, salves, balms, ointments, sprays, roll-ons, or oil. And the cannabinoids in topicals include THC, CBD, CBG, CBN, beta-caryophyllene, other terpenes, and essential oils. So you can put a lot of different botanicals in these. Some of them have a lot of weight to them. Some of them are light and fluffy, and it all depends on preference.
There you go. And so how do cannabinoid topicals work? So topicals work by activating cannabinoid receptors, CB1 and CB2, in our skin, where they're absorbed locally to reduce inflammation, pain, swelling, and provide other medicinal benefits. The onset for topicals is anywhere between 10 to 15 minutes. They're pretty fast acting. The duration can be anywhere from 2 to 4 hours, depending upon the person and how much they use and the concentration of the product that they're using. And so people will apply them a couple of times a day. Generally, a lot of consumers that we work with will put them on in the morning, put them on at bedtime, and then we'll also spot treat in the daytime if they're going to go for a massage or go for physical therapy or going to engage in a sport that may cause some soreness. So they do not enter into the bloodstream, like Elizabeth said. You will not get high. The unique phytochemicals and cannabinoids found in the plant provide the therapeutic healing at the cellular level. The terpenes found in cannabis contributes to the medicinal and entourage effect. And essential oils may be added, like for fragrance or aromatherapy, to continually promote the relaxation response. And the bioavailability systemically is 0. But it works as a local anesthetic to mitigate those local issues or problems. Now, transdermal patches are not necessarily topicals. Transdermal patches have a special chemical in them that allows absorption, so that if you think of a transdermal patch, it has a chemical in it that actually pushes the medicine into the systemic circulation to get circulated in the bloodstream. So transdermal patches do that to allow for systemic receptor activation, whereas topicals generally don't, because they're too fat. The molecules are too fat to be penetrated, and it needs that special ingredient to push it into the systemic circulation.
So using cannabinoids and topicals for conditions, it really does. You take that toolkit and you figure it out, and we can help coach you there. But they have anti-inflammatory and analgesic relief. So that's going to help from pain. If you have twists and sprains like the ankle, your wrist, etc., joint pain, arthritis in the fingers, in the joints, the shoulders, the hips, rubbing it on is really helpful. Muscle pain, Since I've had 3 shoulder surgeries, I have a lot of issues in the lats and the subscap areas and the pecs. Rubbing that on is able to subdue some of that pain. Insect bites and stings and scratches and minor abrasions. And you don't want to put it in anything open, though. So if you've got, something where you've got open skin, open wounds, and any kind of blood, anything like that, you do not want to be using topicals. There's other wound healing methodologies for that. Burns, bruises, and swelling. Once things start healing, you're able to use them. And these cannabinoids have antioxidant, anti-aging benefits, which Sherry mentioned, is what we really want to work with. And it's a huge industry to fight free radicals, the metabolic terrorists that make us look older, moisturizing and nourishing the skin to keep youthful, lubrication for sexual pleasure, but check the ingredients. You don't want to use anything with menthol, antibacterial, antiseptic. MRSA, which is resistant to antibiotics, is being treated now by CBD, CBG, and some of the other cannabinoids, as well as BCP, beta-caryophyllene, and assists with wound healing. So consult your doctor first for boils, cellulitis, impetigo, and folliculitis.
Okay, before you go, I want to talk a little bit about the free radical thing, just so people can kind of get it.
Okay.
Here's an example of fighting free radicals. So just imagine you had 2 apples, okay, and you peel 2 apples, and 1 apple you leave open to air. So it's being exposed to oxygen. The other apple you're going to cover in lemon juice or cover in CBD, right? It's an antioxidant. If you come back in 1 hour, the apple that has been exposed to air that has no lemon juice or CBD on it will start to turn brown, as I call rusting. The apple that has the lemon juice, which we know is an antioxidant, and I've done this experiment myself and I've actually done it with my kids, will be pristine. It will maintain its freshness because it's being protected from the free radicals, the oxygenation. So just think of fighting free radicals is protecting your cells from rusting. That's the best way I can explain that.
So don't get oxidized.
Don't get oxidized.
All right, so this.
Oh, this is me. So benefits of CBD for your skin. So this is courtesy of the South African Institute of Dermatology. Benefits of CBD for your skin. I really like the image, and it kind of just goes over everything that we've already talked about. They say that it cures acne, it helps with dry skin, it reduces the signs of aging, alleviates psoriasis, it's an anti-inflammatory, nourishes dry skin, managing eczema. It's a powerful antioxidant, like we just talked about, rich in omega-6 and 9, and boost the immune system. So benefits of CBD for your skin. Love the skin you're in.
And caring for the endocannabinoid system and the endocannabinoid dome is caring for your skin too. And the dome is the larger environment. So our ECS, our lipid dome, our microbiome, and then all of the other things that we have in our life. So a lot of times when we meet with clients, they're in crisis or they're struggling, they're not surviving or thriving, right? And our job is to move them along this spectrum and this pendulum back over to the thrive zone. And one of the things that is really interesting is that many patients try all of these different types of things, one or some of all of them, and then they don't even think about cannabis or hemp products. But once they do, then they go back and that acupuncture treatment, chiropractic adjustment is more effective. The massage gives them longer lasting care. The exercise really starts working. The food as medicine, the whole foods really start to change and take hold. The restorative sleep gets deeper and better and more nourishing. Social connections become more fun. And this is what we say, a lot of times we diagnose an endocannabinoid system deficiency by process of elimination. I've tried all of these other things. I'm taking my pharmaceuticals, but I'm not getting any better. You put in some cannabis and CBD into the body, and now all of a sudden the lock and keys are jiving. People start healing, and they quickly move over to surviving and thriving from crisis and struggling. And it's because we're nourishing that foundational system that makes everything else work better.
Okay, so conclusion and invitation. So cannabinoids hold the potential to revolutionize healthcare for millions of people underserved by conventional medicine. When discussing cannabinoids, it's more than just THC and CBD. We want to include all of them along with all the routes to broaden the discussion. So inhalation, oral ingestion, sublingual, topical, all hold relevance and offer options to those who need help with skin disorders causing pain, discomfort, irritation, itching, inflammation, mood imbalance, and sleep disturbances. So come join our free network and let's help each other grow in health. And we do have a couple more slides. I think the next one that we have is the poll again. And then we have a few wrap-ups before. Oh, and then of course, Elizabeth. This is Elizabeth and I. Of course, how could I forget this beautiful image of us?
I won the award.
She did. So I do love this picture. It was just so fun. We were actually in an education meeting today with the American Cannabis Nurses Association.
American Cannabis Nursing Association.
Yep. We were just in a meeting with them today. And Elizabeth actually won Educator of the Year in 2023 for the American Cannabis Nurses Association. Out of all of the nurses in the country, she won the award.
Yeah.
So congratulations.
I don't have enough trophies left anymore.
Oh, there we go. Okay. So we have another poll. And this final poll is, did you learn something new and valuable today? And you can be honest. You can truly be honest. Excellent. We can publish this result. Excellent. And then we do have a couple more slides.
Yeah, and do you have a case study to share? We're going to come back to that. But first, just an invitation to join our network. So network.holisticcaring.com. Just hold your phone up, go right into here with your QR reader, and that is going to take you into the gate at the network. Just request to join and we'll let you in. There's a free Introduction to Cannabis course, free ABCs of CBD course, a free patient portal to connect and chat with your peers, a free 7-page medical cannabis guide. So sign up for the newsletter on our website to get that. The free monthly clinical conversations, like you just heard today, our webinars and our podcast. Sherry has a 4-time award-winning Green Nurse podcast, which you can find on the bottom of our website. Just click the YouTube, go right in, and you'll see all of those. We've got patient programs, which is targeted learning by conditions, and then the provider training and mentoring, which is our professional programs. And then, of course, we have that free nurse line to support all of it, 970-404-HOPE, and that triages all care.
And then again, this broadcast was brought to you by Bloom Hemp. And what makes Bloom Hemp different? Well, it's woman and nurse owned. We have a pharmacist on staff, USDA organic hemp CBD, symptom targeted formulas. The formulas were originally formulated by Dr. Sunil Pai, who's a holistic integrative functional health doctor out of New Mexico. And he specializes in Ayurvedic medicine. And then Elizabeth and I have formulated 4 products. We have a new product coming out in the fall, very, very exciting, Immunity Capsule.
Yeah, stay tuned for that. For everybody who's worried about getting sick, CBD, CBG, CBDA, CBGA, all proven to hopefully, in clinical trials, shut down COVID into the cells.
Yep. And so then, Bloom Hemp also comes with a free nurse line, free care plan, the network to support and educate you all. People that are interested in representing the company have the opportunity to become an affiliate and do wholesale and retail. So those are the links to Bloom Hemp.
Yeah, and if you want a free care plan, just put your phone back up again, and you can scan that and go right into the free care plan area on the services tab, where you just fill out a short intake, and we will reply with product recommendations and lifestyle tips for you. And finally, these are just 6 of the products. These are the topicals. And it really is quite amazing when we think about the plethora of products that help. They're all nuanced in different ways. I use this muscle and joint cream every single night. I go through a tub a month, but it is amazing.
Well, I got a story for you.
The Active Care Cream.
So I sent my mother some Active Care Cream. Now, my mother was anti-cannabis years ago, and she basically started using cannabis as medicine after she saw that I helped a nun come off of fentanyl, which is a great story. And we basically her story is great. It's a very gentle story of how she got started. Well, the interesting thing about my mother is that my mother, has been using cannabinoids regularly She had a pain flare. She needed to go to the doctor, which was really interesting. They tested her for THC and she popped positive, and the doctor was horrified. The doctor said, "You're smoking marijuana?" And she's like, "No, I'm not smoking marijuana." She's taking full spectrum CBD and using topicals. And so and it was funny, they wanted her to sign a drug contract that she wasn't going to smoke marijuana.
Which just goes to show you full spectrum oils tinctures can cause a positive drug screen.
But the thing with so I sent her a bottle of active care cream because she was really suffering. And so I sent her a bottle and she ended up calling me up and saying, "I want to order 6." So she ordered a 6-pack.
Six more of those.
6 more of those.
And it really is great for sports injuries. When I've overdone it at the gym and my back is killing me, this is what goes on the back. The soothing balm, great for neuropathy. This has frankincense and myrrh in it, and it is incredible, soft healing, and it's got CBD, CBG, and CBN in here. All of them are just amazing. So check it out. Topical 20, you go to bloomhemp.com and enter Topical 20. It's not just for the topicals, it's for anything in the cart. So save 20% on your checkout. And that is
And then you get resources.
Oh, resources, yes. So yeah, and this is going to come to you in the PDF. So you can click on the links and dig deeper into all of these studies that we have gone through. There's a lot of meat on these bones. So yeah, that is it. That is my last slide. So anybody want to, let me go to stop sharing.
Okay.
And see if anybody wants to come off.
And look, she's right next to me.
Yeah. There you go.
Yeah, would anyone like to come off and either ask a question or share a story or anything? We'd love to have you.
We're here to educate and empower patients to make choices that are best for them. We're also here to decrease stigma around what it means to feel good and be high. Hence the H for hope, I for inspiration, G for growth, and H for healing. The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I was cannabis agnostic for many, many years. And you know, the more research I did, the more I discovered that cannabis is this amazing medicine.
I was told that I had a 4-stage pancreatic cancer. The doctor really told me he couldn't do anything else. He gave me her name and she called me and she came to my house. She started to give me cannabis. My oncologist was puzzled because he couldn't find the cancer anymore.
All of the learning that we get comes from the Green Nurses Group, comes from their support, comes from their guidance. I trust everything that she says.
Simply meet people where they're at. The plant doesn't, stress to grow, so we don't stress to share it. We're healing people.
Cannabis has been used as a medicine for tens upon thousands of years. Here's the big message. Cannabis needs to be federally legal. We need to have laws that are the same across all 50 states that allow access to anyone and everyone who wants to utilize this powerful medicine.